Drugstore.
I woke up this morning feeling real stink. I had the intentions to call it sling, but I end up in Jolly's Pharmacy. Great and down Peter Street, Jolly's fix up my immune system. Got me feeling fit and strong. Now I'm ready to work and take on any mission. If you see me walking, Jolly's Pharmacy is number one. Jolly's walking. We cater for everyone. Jolly's walking. Boost up your immune system. Jolly's walking. Dominic, say boy Father Fox. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Many years ago.
Yes. Good morning to you, and we are so happy to be connecting with you on another episode of Health Vibes. I mean, everyone listens to Health Vibes. Now is the time to call your friend, tell your grandmother, tell your auntie, tell your nanny, and everybody that Health Vibes is on. And we have a very interesting guest today. We have Dr. Pascal, Irvin Pascal, ear, nose, and throat specialist, the only one on Dominica. And we are so happy that he has taken time from his busy schedule to actually give as much information as it relates to these three vital organs. So now is your time to really call in. We will, the lines will be open that you can actually ask Doctor questions relating to ear, nose, and throat. Pearl, good morning to you, my dear.
Good morning to you, Carlton. Good morning, Dominica. Good morning to you, Dr. Pascal. Thank you for being here with us today, Carlton.
Yes.
So I'm very excited about this program because,
Yes.
I have some questions of my own.
I know. So as we said, we have Dr. Irvin Pascal with us, who is an ear, nose, and throat specialist. And to many of us, we sometimes don't pay attention to those three vital organs unless something is wrong. And even last week or 2 weeks ago, I said, on air that I need to see him myself.
That's
because
right.
I've never had a checkup, to check my ears and my nose and my throat. And so I think it's time that I really pay attention to that, particularly because I'm getting a bit older. I suspect we have a caller already. Good morning, caller.
Good morning.
I'm blessed and spirit-filled day to you and yours.
Good morning to you, my friend from Barbados. All is well with you?
No, I'm still in convalescence of my surgery.
Okay, all right.
Might have to go back again.
Oh, wow.
But we should speak it as though it were, so you are well.
Okay.
Okay, all right. Thank you.
Right.
Just so you know that I'm listening.
Excellent. And if you have any questions relating to the topic today, feel free to call back. All right?
Well, when the doctor comes, I guess he's probably listening.
He's here already.
I noticed now the younger folks piercing in their eyes. And at the side of their eyes and thing, I want to know, and piercing their faces. So I want to know if that is a good thing, if it's dangerous.
All right, that's an interesting question. All right, I think he'll get to that question. But we want to really begin the discussion by, Dr. Pascal, just giving a sort of summary as to how essential, is the ear, eye, and nose, and how are they linked. Sometimes they tell you that when you sneeze, your eye gets feels, know, and if something happens to your eyes, then your nose runs, so it would seem that they all seem to be linked. So just give us a preview. Can this person just call back while Doctor just introduce, because we just introduced on the topic, if the caller doesn't mind. Thank you.
Morning to everyone. Morning, Carlton. Morning, Pearl. Thanks for having me here. Morning to the listening public. It's, as I say, it's always an honor to come to share the little knowledge I have on my area of specialty with the general public, for the simple reason that I think I am more into prevention rather than cure. And I think the more you know, the more power you have. Information is power, and we live in an age of information. So I'm quite happy to be here. In reference to ENT, which is what I do most of the time, for the last 20 years or so, it's interesting because it's interesting what you said, but when you think about it, I feel privileged to be working with these areas of the body for the simple reason that we forget these are the, if you want to call it, the gateways that connects us to the universe.
True.
So besides seeing your smell, your taste, and your ears, these are ways that, so essentially they're much more important than we realize, especially in our, if we think about equilibrium and well-being and quality of life. On the contrary, because that's the level at which they function, we tend to, like breathing, just take them for granted. We're not even aware that they're there until they start to affect our quality of life. So usually the majority of ear, nose, and throat issues are really quality of life issues. And interestingly, what has been shown, the research has shown that it's the practice of ENT is tend to be a lot more involved, or if you wanted, maybe a little bit more lucrative in places where people have a certain quality of life, so they can now pay attention to your ear, nose, and throat, as you're talking about prevention. Because most other situations, if you're economically deprived, you have so many other pressing matters to attend to that the little congested nose, the little itch in your ear, you tend to neglect those to deal with. So that's maybe one of the reasons why you don't find that mass movement towards checking your ear, nose, and throat, or the ENT specialist. So that's basically my introductory comments on being an ENT specialist. So in Dominica, you find that, I found that you can tell the difference over the years where in the type of complaints that people come to me for, and I've seen it shift, and so I know when things are economically when people are economically
it's quite
challenged.
like going to the dentist.
Yes.
Many people won't go to the dentist because they may be economically challenged.
Yes.
So you find that that's not where they would gravitate to.
Yes.
Yeah, so I totally understand.
I wanted to really get the ball rolling a bit, and introduce one of the areas that I've seen in my practice as a pharmacist, vertigo. And I find it's becoming more and more common, particularly among women. And I'm not too sure if there is something to do with hormonal levels and aging as it relates to vertigo. So just maybe sensitize us. What is vertigo and what causes it and so forth?
Yeah, that's a very important and important area. For the simple reason that it all goes back to definition. A lot of times people will say they're dizzy or they're off balance, and then they might go to the health practitioner who says you have vertigo. But by definition, vertigo is just a symptom. It's not a diagnosis. A lot of people think it's a diagnosis, and they come to me saying, well, I was told I have vertigo. What can you do for me? But vertigo is really a symptom, just like saying I'm dizzy. Because all it is, it's an illusion of the environment moving relative towards you. So you're not moving, but you feel that the environment is moving. Even like when you go on the merry-go-round, and after you get off, everything is spinning, that's vertigo. So that's what vertigo is. So, so by definition, most people really don't have vertigo per se, because what they describe a lot of times is they're feeling giddy or off balance. And so those are really, but they would all come under the same rubric, if you want, of not being clear in the heads or feeling off balance, of what's called giddiness. So it's a general symptom, but it's specific in the sense that it's related to the environment, usually the room spinning relative to the individual. So if you lie on your bed and the whole room spinning, that's vertigo.
So what are some of the causes?
Well, the causes are multiple. Often it can be related to your ear, but if we look at the causes in terms of the things that are important to your system of balance, so there's 3 or 4 areas of the body that are really concerned with your system of balance. One, you have to, if your vision is not optimum, it can affect your balance. For example, because you need to see where you put in your leg. So that's one. Your ear, it has organs of balance that tells your body where you are in relation to the environment. So that's the other organ that's responsible for your balance. Your joints, because you have sensors in your joints that will send messages to your brain that are important. So that's why you might find in the elderly group, they have more problems with balance and dizziness because, one, they may not be seen as well because of cataracts, etc. Two, they might have a bit of arthritis. And that's why you will find one of the common things that the elderly would do in the past, you'll always see them with a stick.
Yes.
Now, that stick was to help them to be more balanced because it was another way of sending messages to the brain where you were. So instead of just if you only had your 2 soles of your feet sending messages and you have arthritis, that might impair the messages. So when you have a stick, it short circuits the feet. It goes through your arms, the messages to your brain to tell your brain where you are. So that's why using a stick is so important among the elderly who have balance issues. And of course, finally, your brain is where everything is integrated. So that's the sort of, you would call it the seat, the king of balance. So balance issues like vertigo, dizziness, imbalance are related to these 4 areas. So it doesn't necessarily mean if you have a balance issue or if you have vertigo, it's an air problem. Obviously, it can be an air problem, and you need to rule out that it's not an air, or it is not an air problem. But it could be problems with your joints, it could be problems with your vision, or it could also be problems with your circulation as well, because if you have circulation issues where the blood doesn't flow to the balance organs, then it's going to function as well. So it's a multiple causes, multiple areas may be responsible for.
I personally have learned from this already.
Absolutely. In your years of experience, what are the most common ailments that you find in your practice?
In my practice, in Dominica, the most common things are really related to people who have nasal allergies or congestion in their nose, difficulty breathing, people who have issues with outer ear infections. Those are the sort of the most common things. And now more recently, there are 2 areas that I have seen increasingly. It's people feeling a symptom of what I would call it, let's put it this way, just they feel that there is something in their throat. So the complaint is usually that I have a discomfort and something in their throat, which is, to me, I'm seeing more and more people with this complaint, and people with enlargements of their thyroid gland, what is commonly called goiters. So definitely those are the common areas. People with nasal allergies, people with external ear infections, and people with an impression. It's a feeling. It's described as, I feel like there's a lump in my throat.
But usually, you wouldn't maybe you would definitely do assessment and find out. But a lot of this throat issues is sometimes linked to acid problems.
Well, that's why I think that's the reason for the increase in incidence of that complaint. As the lifestyle changes, I think we have more and more people who have the problem related to their diet, how they eat, that leads to acid-related issues that then gives you that symptom. I think that's maybe one of the main reasons. Also, the more stress or pressurized you are in your day-to-day life, it's the more these conditions like feeling a lump in your throat take precedence, because you tend to be more focused, be more worried about little things. And I think the modern pressurized life also is contributing to the incidence of people complaining of these things. Maybe they were there before, but life was much more gentle and gentler. So people would say, that's nothing to worry about. These days, with the awareness of not only just the awareness, but also the pressurized life, I think, contributes to that.
But in reference to the fruit, though, and in your investigation, would you say that alcohol abuse and tobacco smoking may precipitate symptoms that may, affect the lining of the fruits?
Yeah, definitely. Number one, in terms of smoking is directly related to most of the ENT concerns dealing with your nose and your throat, because the smoke, that's how it gets into your lungs. It passes through your nose, at the back of your throat, and gets into your lungs. And on its way, obviously, some of the impurities are going to be deposited. It's going to cause some irritation, so it's definitely indicated. But in terms of your throat, there are several reasons why that have been proposed why you have problems with what we commonly call acid reflux, or what I think the old people used to call a gas. My feeling is that this gas that we have all come to know about was really the old-fashioned way of talking about acid reflux or acid issues. And so there are several factors that are implicated in this gas, or what people like me call acid reflux. It's that, number one, if you understand it, is that your stomach is separated from your esophagus. Your esophagus is that tube that carries the food from the back of your mouth to your stomach. So there's a valve, supposedly a one-way valve, that allows the food to go in one, or whatever you eat or drink, to go in one way from your mouth into your stomach. That valve, however, can lose its, how would I call it? It loses its efficiency, loses its ability to function in one way. So instead of substances going in one direction towards your stomach, substances from the stomach can reverse if the valve loses its integrity or its ability to function. Now, there are several factors that can affect the valve. One is what you eat. Two is when you eat. Three is what you do after you eat. But also other things like alcohol, smoking, some carbonated drinks, coffee, you name it. It varies. There are general things and there are specific things. So all those things, and some drugs as well, that you take for other conditions, can affect the ability of the valve to function. Even it's thought that things like being overweight, that stretches the valve. So all of these things can contribute to the valve losing its ability to function in this one-way direction, so that stuff that's supposed to be kept in your stomach comes back up into your throat and then causes the symptoms.
That's interesting. I think I've never had it explained to me that way, and I think that makes a lot of sense.
Yeah, so that's basically what I think, because our lifestyles have changed in how we eat and what we eat on the run, we eat what I call food-like substances or bad food. We eat and we go and lie down right away. These are all the things our old people never used to do. They would never eat and go and lie right away.
And their dinner was always bush tea.
And always something, very light. So
a little cracker.
So it's when we have this lifestyle where we work in, I don't know for what, so hard, 9 hours a day. We come home. I had a patient the other day who tells me, well, how can she do it? She finishes work maybe at 8, gets home, exercises, eats, and then she goes to bed. So that's a recipe there for having issues with your throat and acid reflux and all the symptoms. The important thing about it is that from, at least from my perspective, it's something that's preventable by the way your lifestyle. And then, so that's on one end of the spectrum. On the other end of the spectrum, it is, research has shown that if it is untreated and it's there for 20, 30 years, it can lead to other serious problems, because the acid that's supposed to be in your stomach, that's where God made it to stay, not to come back up into your throat. So when it comes into your throat, it can cause other issues by chronic inflammation and strict, what you call narrowing of the air, where you have problems swallowing and things like that. So that's why it's important to recognize.
Another area I wanted to discuss was snoring. And it's one of the areas, you put on the television and there's so many products that are being advertised, for snoring. Some of them, I think they work. Some of them, they don't work at all. Some people say it's caused when you're very tired.
Right.
What is snoring? And is it normal to snore? And,
What causes it?
What causes it?
Yeah, I like to say that my husband snores when he's really tired, right? But when he does, I give him one, turn him on the side, and then he stops right away.
Okay, I mean, from a ENT perspective, snoring by itself is not a medical problem. It's a social problem. Like you just exemplified, in the sense that if your partner is snoring or somebody close to you is snoring, the noise is like noise pollution. So it's a social problem. You can't get to sleep. You need your rest so you can go to work in the morning. And actually, I was surprised when I went to the UK to specialize. I mean, coming from the Dominican culture, I was surprised to find out that was a grounds for divorce. People actually, well, I don't know if it was the real grounds, but that would be the reason why people are finding difficulties, because the snoring, whether it was used as an excuse or genuine. If your partner is snoring loudly and you have to go to work, after a while you can't take it. So the partner then has to go and sleep on the couch. And that's the beginning of the end. So it's a social problem on the one hand. The reason it's important for the ENT, and actually another thing is that it's not the snorer who comes complaining that they snore. It's usually somebody else. So you can see it's not really, the person doesn't see themselves as having a problem, because very few snorers come and say, I snore. They only come and say I snore because their wife says they're going to put them out of the bed. So what can you do about it? But the issue about snoring is that the important thing from a medical perspective, it's associated with a medical problem called sleep apnea, obstructive sleep apnea, meaning that for the people who snore, sometimes they just go quiet, they don't snore, and then they almost start to choke, like they're waking themselves up to get oxygen because they have stopped breathing. So that's the importance of snoring, is that it's associated with sleep apnea. And every time you have an episode of sleep apnea where you stop breathing, it puts a lot of strain on your heart and your lungs, and thus the medical issues that may arise. Either you become stressed out, your pressure goes up, you're predisposed to cardiac issues, heart issues and lung issues. So that's the importance of treating it. Also, if you have snoring with sleep apnea, meaning there are periods, what sleep apnea means really is that there are periods during the night when you're sleeping and you're snoring, you stop snoring, but you stop breathing as well. So that is really the issue. So it can happen in children, and that affects their growth and development. And when it happens in adults, you don't get proper sleep at night. So the following day, although you think you've been in your bed for 8 hours, you really feel exhausted and tired. You may have headaches, and you fall asleep easily. Now, the implications of that are several. Number one, you can't concentrate and produce significantly in your 8 to 4 job. According to the work you do, you are at risk, as well as the people you work with. So, for example, if you're a truck driver or something, you're tired all the time, you fall asleep easily, you can easily get into accident if you operate in certain machinery. So besides the social problem, it does have a medical. So the causes are several, but again, the most common associated identifiable cause with an increase in snoring, not just snoring, most people snore, but this progressive increase is overweight, obesity. Obesity is maybe because what happens is that when you put on weight, you can put on the weight, you'll put it on in several places. In men, they tend to put it on around their waists and around their necks. So what happens is that when you breathe in, there's more tissue there to vibrate from the obesity, so because it's narrow. So one of the main things we do for people who snore, whether or not they have, is to encourage them, if they're overweight or obese, to do something about, or to go back to to the way they used to be before the snoring became a problem for their spouse or their family.
That is
interesting, very interesting. It's like there's so much to learn. Okay, so I there's two things that I'd like to talk about. Right. One is nosebleeds.
Okay.
I have a son who often gets these nosebleeds.
Yeah.
He wakes up in the middle of the night and he's like, my nose is just bleeding. What causes that?
Okay.
And what can we do to kind of prevent it from happening?
Yeah.
That's the first thing. So you can go ahead.
All right.
And then
But let me just finish it. I just realized I didn't. The other causes of snoring, there are several, but I just wanted to point out to that. Because as I said, my bias is towards prevention. So that people can start looking at the obesity related to other problems. But you can have issues with your nasal passages if they're blocked because you have allergies, you have growths in them, you have polyps, or the septum, which is the partition that divides your nose, that can block your nose. So those are things that can be remedied as well to improve snoring and sleep apnea. In children, commonly, if they have large adenoids and large tonsils, sometimes in adults as well, or growths in the back of their throat, that can cause snoring. Sometimes it's also some people have very large tongues relative to the size of their mouths, all those things. Because what happened in relation to the question you asked earlier, when your husband is tired, what happens is that if you're tired and you go to sleep, and then maybe if you've had maybe 1 or 2 drinks or you take some sleeping tablets, what happens, those muscles around the back of your throat that vibrate, they relax. So they vibrate more. They're not tense. So that's why you will find when people are tired, they're very tired, their muscles are relaxed, so it vibrates a lot more and you get more snoring. So in children, it's the same thing. So what you might have to do in children is, if they're snoring and you're worried about it, because I have to tell parents all the time, it's a child that's my patient. It's not you. You can't sleep. That's your problem. But so because patients comes asking me to do something about the child snoring so they can sleep. But you see, the conflict there is that the child is the patient.
It's true.
I cannot treat the child so you can sleep. But one of the simple things that you can do is also turn that child, or like you said, you give him a nudge, he wakes up, the muscles retain, they're not anymore relaxed, and usually he will turn and lie
on his side, and no more snoring.
Because when you turn on your side, your tongue doesn't fall back and block the airway for it to vibrate. So one of the simple things you can do is to just make sure the child is not sleeping on their back, because when you sleep on your back, your tongue falls back. So they do all kinds of things. They put a tennis ball in your back. They do all these types of things to prevent you from lying on your back, because if you lie on your side or on your stomach, your tongue will fall forward and there'll be less tissue to vibrate and make you snore.
Interesting.
I want to really, I want you to cover, I want Doctor to cover the nosebleed, but I just want to link something quickly that someone just asked me. I'll say it in Creole name. Most people know it as kokma.
Yes.
That's, I don't know if you've known that, where people feel like they're having somebody choking them in the night and they can't breathe, and some people think it's some spiritual demon and all of this thing. What is that? I mean, I know what it's doing. I know what the principle
asking me what is that for.
But it's one of the things that scares people, because you just hear somebody screaming and that type of thing.
Well, what I think is it's exactly what they do in what you call waterboarding. You can't get oxygen, you think you're going to die, you get scared, and you wake yourself up. That's basically what happens. So when they waterboard you, the fear and the fright comes from an impression that you're going to die, but you're aware that you're going to die. So that's the frightening experience. So that's how it works. So that's my explanation for what happens in what we call a kokma, is that either you had some acid come back up into your throat that irritated your airway, and then it's shut down because it wants to protect itself, and you have no air. So you actually have the sensation that you're going to die, and that's what is this nightmarish episode about. Or you stop breathing for whatever reason, and then you have to wake yourself up so you can breathe. So you wake up screaming, and then everything is okay. There might be other spiritual reasons, but
most times you find that the heart is always racing as well when you've woken yourself up.
That's because it's trying to get oxygen to your brain and to your lungs and where it's needed. So it has to speed up because you've stopped producing oxygen, you stop taking in oxygen.
Yeah.
So your heart now beats very quickly so that you can now get oxygen to those areas.
Well, I'm glad that you didn't rule out the spiritual aspect.
No. Obviously, I mean, everything has a spiritual dimension. So that's just the ENT dimension.
Now, as far as nosebleeds.
Yeah, nosebleeds are, they're common. We've known they're a common ENT problem. That is usually a first aid, more or less. It's very rare that they are so severe, especially in our population, that I have to get involved. Most times they're self-limiting and they settle down. There are lots of common causes, usually having the flu, having some irritation, nasal allergies. But what happens in these cases is that by reflex, if your nose is troubling you, you tend to scratch it back, especially in children. And when you do that, you traumatize the lining of the nose, and that's when it bleeds. So that's why you'll find most times nosebleeds occur at night in children because they're asleep, their nose is bothering them, they itch it back whilst they're asleep, and then they wake up and it's just bleeding. It's just run. So that's usually nothing serious. It's fairly common, and it usually stops on its own. The concern is if it's happening regularly for prolonged periods, because every episode you lose some blood, so you're kind of worried about that. And there may be, in rare cases, other serious causes like growths in your nose or infections in your nose, or even tumors that can be associated with nosebleeds, but those things are very rare. The most common cause of nosebleed is usually irritation of the lining of the nose that either bleeds on its own because it's inflamed and irritated, or bleeds because you traumatize it in trying to deal with the irritation. So that's why one of the things that we commonly advise is to make sure a child who's having nosebleeds regularly, they're not congested all the time. You give them something to decongest their nose, sometimes just some normal saline drops at night, or so maybe a little bit of moisturizer so it's not dry and irritating. And you cut the fingernails as well. Make sure they have short fingernails because it's the long fingernails at night that usually causes the problem. And as a first-line treatment, again, it's just a simple matter of not panicking. Well, it's easy for me to say. Most people do panic, but really and truly, unless it's really heavy and continuous, it's not anything that a parent or even the non-medical person needs to worry about. There are basic things that you do. You want to stop the bleeding as best as you can. So usually you what we call pinch the nose, so that the sides of the nose are pinched against the center. Okay. So do that for 5 to 10 minutes usually stops the bleeding. So if you do that and the bleeding persists, that's when you need to get some intervention by a health professional.
Do you put ice? I know people have
you
incline to push back the head and put ice. Is that
you can put some ice, but usually in the non-medical person, that's usually difficult to be pinching the nose and having some ice. It gets a little bit. So what normally you can do that as well. So you can put a cool rag on the nose and then hold the rag and pinch the nose. So you have two ways of controlling the bleeding, but you can also give some ice to suck on. But the other thing, and you just mentioned that you shouldn't do, is lean the head back. You lean the head forward. You lean the head forward, and because you don't want the blood to go back into the throat, you want the blood to get out. So if it goes into the throat, you just tell them anything in your throat to spit it out. But really and truly, if you're holding the nose tight, there's no blood. It's still going to go in your throat. So you ask the patient to not swallow it, because what happens if you swallow the blood, it irritates your stomach, and then you vomit. So you're vomiting, and then you have your nose bleeding, and then everything gets a bit chaotic. But the people by reflex tend to want to put their heads back. No, you put your head forwards. Actually, it's better to just let it flow. So you hold in pressure, you can, release it, let the blood flow. But if the blood goes backwards instead of coming forward, you just spit it out. You just don't swallow it.
Very interesting.
Very interesting.
I remembered years gone by too. My mother had a daughter who was suffering from nosebleed, and they would say, well, when you play in the sun can actually precipitate or cause a nosebleed if it's very humid and hot. I mean, and they run all over the place.
Yeah.
Is that? Have you seen that? Is that scientifically true?
Well, you can explain it by, if you're playing in the sun, you're dehydrated, the air is dry, then your nose that might have been irritated already from the flu gets more irritated or gets more dry, and a child playing in the sun invariably just hits the nose, or somebody bounces, it's going to bleed. So it's not that the sun causes it, it's the conditions under which, because if the sun caused it, we'd all have nosebleeds in Dominica every minute. So it's usually because the child is already predisposed to nosebleeds, and the combination of playing in the sun and the drying out of the lining of the nose and the dehydration from not drinking whilst you're playing, and all of those things could possibly predispose to it. So that's another cause of, an associated with nosebleeds, but it's no reason to keep the child out of playing in the sun.
And I mean, as a doctor too, I mean, you would know that the nose is one of the most vascular organs.
That's right.
Really, there are a lot of,
it bleeds easily. Bleeds easily.
So that's important. I know one of the issues too that we've seen. When callers can always call, is sinus problems. Many times people come to the pharmacy and they say they have sinus, and we say, well, everybody does have sinus. You have a condition called maybe sinusitis or rhinitis or so. And we have a call. Okay, caller. Good morning. Thanks for calling. Thanks for calling, caller. Good morning.
Yes, very, very, very interesting program, Dr. Pascal.
Thank you.
I want to ask if persons who suffer with diabetes, hypertension, and sinusitis, if they have the same, the name you called just now for like head spinning and things like that. Because a few of my friends, they are elderly persons, and they had to go to the doctor all in December, and I think one went up to last week for the same thing.
Yeah.
So I wanted to know if because they're diabetics and hypertension too, and some have sinus, so I want to know if it can cause that.
Okay.
Good question.
Well, thanks for your question. The answer is that it's not that they can cause it. I mean, diabetes and hypertension, although if your pressure is really high, you can have problems with, because what happens again is that the blood flow or the functioning of those organs responsible for keeping you in balance or in equilibrium get affected. So they are often associated, because most of the people who suffer hypertension and diabetes also have issues with circulation of blood to their ear, to their brain. They may also have problems with vision. They may also have a little bit of arthritis. So they're all associated. But I wouldn't say you would say that's a cause of the problem. Okay, I hope that clarifies it for you.
We have another caller.
Good morning, caller.
Good morning.
Good morning to you, caller.
Hello?
Yes, good morning. Can you speak a bit louder, please?
Yeah.
Thank you.
Good morning to all.
Good morning.
Good morning.
Yeah, I was saying that a young lady was in London and her nose was bleeding all the while she stayed there. What will be the cause of that?
The temperature.
Well, in London, what happens, as I said, we don't have many cases of severe nosebleeds in Dominica, and that's because of the climate. It's the climate that tends to dry out the lining of the nose and makes it a lot more susceptible to bleeds. Also, that's why they humidify the houses, and so especially during winter, the heating also contributes to that, because it dries out the lining of the nose. So nosebleeds and severe nosebleeds that require people to be admitted and treated and are life-threatening tend to occur much more commonly in these environments. So it's really related to the environment.
We have another caller. Good morning, caller.
Good
Thanks for
morning.
calling.
Good morning.
Yes, a very twisted program. Good morning to you all in studio.
Good morning, my friend.
I heard you I heard you asking the doctor about the explanation about what happens when someone has what they call kokma.
Yes.
And I think we all could have an explanation, but sometimes it's when we look at what makes sense and what doesn't, or if it's reality. I think what it is like I understood from my circle of knowledge that when you sleep in, because we all have a physical body, and in that physical body we have a spiritual body. So when the spirit leaves the body while you are asleep, but your body wants to wake up, but it can't wake up until that spirit comes back, or else we'll be like a zombie. The spirit haven't entered your body. I mean, it happens to me several times. I mean, and to the point where I understand what's going on, so I just relax my body. And sometimes the first thing I start doing is moving my toes first. And then even because I can't wake up if my spirit haven't come back, because I'll be like a zombie. I'll be up and I don't know who I am because my spirit haven't come back yet. But that's my explanation,
Interesting.
Type of understanding about it. Yours, I'm listening to yours.
Yeah,
thank you.
That's fair enough. That's what I said. I couldn't delve into the spiritual aspects of the thing.
Well, I have a question. I'm curious about ear infections in children, more particularly, because as a parent, you find that you get so nervous. Like, what is this, And also, too, what are the different variations with earwax? Because my son sometimes has white earwax as opposed to brown. And I'm trying to figure this out, because sometimes I have to look into the ear with my light and everything.
Okay, that's a very good question, because it comes back to what you said initially. It all seems that they're all connected.
Yes.
Your nose, that's the way the Creator made it. Your eyes is connected to your nose by a little tube that most people are not aware of. And then your nose is connected to your ear by another tube, and then your ear is connected to your throat by another tube. So anything that affects one can potentially affect all of them. So that's the first thing. Now, the issue with ear infections is that there are ear infections that are the infections of the outer ear. That's usually when it gets a discharge and from itching and things like that. And that's maybe where we'll talk a little bit about the wax issue. And the ear infections that are called middle ear infections. And those in children are fairly common. Because usually they're related to having what we call upper respiratory tract, which is the runny nose. So once your nose is congested, or once you have any irritation, inflammation, flu, whatever you want to call it, you have a potential of having a middle ear infection. Because number one, the protective mechanisms to prevent it are not as fully developed in a child as an adult. So sometimes it's the position in which a child sleeps. Sometimes all those things allow the secretions, the inflammation to spread from the nose to the ear, and that's when you get the ear infections. They are readily treated in modern day medicine with the usual, something for the pain, the fever, some antibiotics. And usually we don't see any severe complications related to that, except if they are very frequent and very severe. If they're very frequent, sometimes they can lead to problems related to hearing loss. And most health practitioners would recognize somebody who's having frequent ear infections and make sure that these things are ruled out. You can also get meningitis, which is an infection of the lining of your brain, because your ear, if you think about it, is right close to your brain. So, and in children, again, because all of the connections are not sealed and healed, infection can spread from your ear to your brain. So those are the two major things that you can get. In our modern civilization, they're not as common, especially in places like Dominica, where you can readily treat the ear infections, those ear infections with antibiotics. Secondly, as I said, secondly, in terms of the wax and outer ear infections, so you have what we call middle ear infections. That's on one side of your eardrum. So if you have an eardrum, and then you have infections on one side, that's called, and the outer side of your eardrum. So if you imagine your eardrum like a plate, you have outer and inner. On the outer ear, that's where you have the wax, and you can get infections there as well. But those are a little different from the middle ear infections. Now, the wax is a very interesting phenomena, a very interesting thing in ENT practice, because most people think the wax is dirty or it's a problem they have to deal with.
Right.
It's not.
Yeah.
It's actually more protective than anything else.
That's
so
true.
But what's the difference between hard wax and moist?
Yeah, okay, I'll come to that. So people do spend quite a bit of time trying to get rid of the wax simply because they don't like to see it or they think it's dirty. So I want to dispel that. Wax must have been put there by the creator for a very good reason, because it's obvious. If it wasn't, you would have easy access to
the air. That's true.
Just think about it. The creator, I maintain, must know what he or she is doing. So they could never have intended for you to be trying to get that wax out. You can't see what you're doing. It's a little hole. You have to go and invent something, a hairpin, a Q-tip, a piece of stick. Come on.
Yeah.
So it just goes to say, by nature, you're really not supposed to be interfering with the wax unless it is causing a problem. And that's where it comes to your question about the hard wax. Sometimes, because the wax is produced by the skin of the ear, but sometimes, according to your type of skin, it affects how you produce the wax. So if you have, especially you ladies talk about different types of skin for different creams and whatever. I don't know much about that, but I know. So